Looking back at the Green Transition panel from earlier, one point that seemed to unite the speakers on climate change is that this international problem calls for an international response and international cooperation. However, uniting sovereign nation states behind one cause is often easier said than done. This is an issue the next speaker has undoubtedly run into in her senior position in the World Health Organization. With this, we are honoured to welcome Dr. Zsuzsanna Jakab, the Deputy Director General of the World Health Organization. Between 1975 and 2005, Dr. Jakab held various public health posts in the Hungarian government and the WHO. In 2005, now a public health expert, Dr. Jakab became founding director in the newly formed European Centre for Disease Prevention and Control. She was a key player in propelling this organization to its current size and importance. She then served as WHO's Regional Director for Europe before being appointed Deputy Director General in 2019. Back then, in 2019, no one could have foreseen what was to come, or what Dr. Jakab's tenure would be like under a deadly global pandemic. WHO bears enormous international responsibility and is facing its biggest challenge yet. We thoroughly look forward to hearing from one of its most senior members. As this is a pre-recorded video, there will be no Slido. We turn now to hear from the Deputy Director General of the World Health Organization, Dr. Zsuzsanna Jakab.
Distinguished guests, esteemed colleagues, and dear friends, thank you for the opportunity of sharing a few reflections with you today. COVID-19 is an unprecedented global crisis that has shaken the foundations of social, political, and economic security. The pandemic has exposed and exploited the gaps in our health systems and the inequalities of our societies. It has overwhelmed the health systems in even the world's strongest economies. The pandemic has shown us that health and the economy are integrated and interdependent, and that the impact of public health events far exceeds the implications for the health sector alone. Global and national economies have been deeply affected. Many people have lost their jobs and sources of income, and in some places, unemployment is at record levels. In some public debate, the response to pandemic has been framed as a choice between health and the economy. That's a false choice. We do not have to choose between lives and livelihoods. Many countries have shown that with a comprehensive whole-of-government approach, using evidence-based tools, widespread transmission of COVID-19 can be avoided or controlled. But for far too many countries, the pandemic has led to chaos and suffering. Essential healthcare services have been disrupted, hunger is on the rise, and many services to prevent and treat communicable diseases have been interrupted, including immunization. More than a year after the pandemic began, billions of people are facing widespread restrictions that threaten lives and livelihoods. The work and family lives of millions have been shattered. Virtual education is further entrenching the disparities between the haves and the have-nots. As with so many disasters, the poor and other already marginalized groups suffer the most. And the COVID pandemic is jaw-droppingly expensive. Current analysis suggests that it could cost the global economy between $8 and $18 trillion. We have seen the impact of COVID-19 on essential health services. It has pushed many health systems to the brink of collapse, with countries reporting disruptions in care because of mismatches between supply and demand, including, of course, the increased demand for care for people with COVID-19. Even as we fight it, we must all learn the hard lessons the pandemic is teaching us. First, the time to prepare for emergencies is before they occur. We must invest in preparedness capacities that protect every community against current and future health security threats. Investments in strong health systems rooted in primary health care are the best defense against emergencies of all kinds. A strong health system is a resilient health system. WHO support for country preparedness is rooted in the idea that the best defense for health emergencies is strong health systems based on universal health coverage and primary health care. Second, preparedness goes far beyond the health ministry. Just as health emergencies impact all sectors, the responsibility for preparing and responding to emergencies must be shared and coordinated across sectors. There must be engagement across including foreign affairs, finance, parliaments, water and sanitation, labor, trade, and others. Third, preparedness demands stronger engagement of local government, the private sector, community leaders, and civil society, especially in urban settings and among the most vulnerable populations. This will not be the last pandemic, nor the last global health emergency. But with the right political and financial investments now, we can advance health security, prevent and mitigate future pandemics, and protect our future and the future generations to come. All countries face challenges to the sustainability of their health systems, with rising costs, demographic changes, the rise of non-communicable diseases, inequalities, and increasing concerns around health security. Primary health care is vital for addressing all these challenges. It goes beyond delivering essential health services to working with other sectors to address the root causes of disease in the air people breathe, the food they eat, the water they drink, and the conditions in which they live and work. Financial costs should not be a barrier for countries to invest in building resilience, because in the end, the dividends gained by addressing universal health coverage and health security simultaneously leave us collectively better off from both a financial and a health point of view. The lack of access to affordable, quality health care does not just have consequences for the health of individuals, it's also a brake on social and economic development and a threat to global health security. It keeps people bogged down in poverty, saps productivity, and drains hope. Returning to the status quo is not an option. We don't just need more investment in public health. We must also rethink how we value health. The time has come for a new narrative that sees health not as a cost, but an investment that is the foundation of productive, resilient, and stable economies. To start building that narrative, WHO is establishing a new council on the economics of health for all to focus on the links between health and sustainable, inclusive, and innovation-led economic growth. Of course, innovation is not the preserve of high-income countries alone, and much can be learned from low and middle-income countries which bear the lion's share of global burden of disease. The Council will comprise leading economists and health experts and will be chaired by Professor Mariana Mazzucato, Professor of the Economics of Innovation and Public Value at the University of London and the founding director of the university's Institute for Innovation and Public Purpose. Another valuable tool is the UN framework for the immediate socioeconomic response to COVID-19, which supports countries in addressing the ongoing socioeconomic risks associated with COVID-19 and the transition into longer-term recovery and strengthening resilience. The framework focuses on a number of goals, including helping people cope with adversity through social protection and basic services, protecting jobs, supporting small and medium-sized enterprises and informal sector workers through economic response and recovery programs, fiscal and financial stimulus to make macroeconomic policies work, and promoting social cohesion and investing in community-led resilience and response systems, and ensuring that essential health services remain available and protecting health systems. Ladies and gentlemen, while COVID-19 has highlighted weaknesses in all countries, it has also provided a great opportunity for the world to revisit collective ways of working, investments, and priorities. The world needs solidarity, which is a clear requirement for effective preparedness and response. The development and approval of safe and effective vaccines less than a year after the emergence of a new virus is providing a much-needed source of hope. The challenge we face now is to ensure vaccines are a source of hope for all, not hope for some. In April last year, WHO joined forces with Gavi, the Global Fund, CEPI, and many other partners to launch the Access to COVID-19 Tools Accelerator, including the COVAX vaccines pillar. Our aim was to develop vaccines, tests, and treatments fast and to distribute them fairly. But as we speak, rich countries are rolling out vaccines to their citizens, while the world's least developed countries are left waiting. More than 90% of countries now rolling out vaccines are high or upper middle income countries. 75% of doses have been deployed in only 10 countries. We understand why governments want to protect their own people first. But sharing vaccines equitably is not just the right thing to do. It's also the smart thing to do strategically and economically. First, the longer the virus continues to circulate, the more chance it has to mutate and potentially become resistant to current tests, treatments, and vaccines. In other words, we could end up back at square one. The pressure on economies, businesses, and jobs will remain intense. In our global village, if the virus continues to circulate, global operations and supply chains will continue to be disrupted and the economic recovery will be delayed. We are now at a critical juncture. As our Director General recently noted, we are at risk of a catastrophic moral failure. The world must not let the introduction of new vaccines deepen already existing inequalities and introduce new ones. We must work together across borders and regions to prioritize those most at risk in all countries. But we must also recognize that we cannot win against the virus with vaccines alone. Proven public health measures must be kept up, and individuals must remain on guard, otherwise we risk another resurgence. We also need to massively ramp up access to effective diagnostics, therapeutics, oxygen, PPE, and strengthening health systems to deliver these. Until we end the pandemic everywhere, we won't end it anywhere. I will end with some encouraging news. Globally, and in almost every region, the number of reported cases of COVID-19 has declined over the past few weeks. Of course, many countries still have increasing numbers of cases, but at the global level, the trend is positive. This shows that with proven public health measures, we have the power to limit the spread of this virus. Even with the new variants in circulation, we can bring this pandemic under control. But it also means that it is more important than ever that we not make the same mistakes as were made last year. Many countries responded to a decline in cases by easing public health and social measures, and individuals let down their guard. The virus came roaring back like a forest fire that has found new fuel. Positive trends can easily be reserved and hard-won gains can be lost. Now, as we begin to roll out the vaccines, we must remember that vaccines alone will not control this pandemic. It is vital that governments do not rush to reopen and that they continue public health measures to prevent the spread of the virus. Individuals must continue to take precautions. That means doing what it takes to ensure safe working conditions, implementing manageable quarantine conditions, and safely reopening schools and other essential services. Controlling the spread of the virus saves lives now and saves lives later by reducing the chances of more variants emerging. And it helps to ensure vaccines, treatments, and diagnostics remain effective. WHO is calling for a historic effort to roll out vaccines to all countries in the first 100 days of this year to ensure that all health workers and those at highest risk are protected. We have just 63 days left, but we are making progress. There is no time to lose. My friends, in the midst of a great deal of darkness in this pandemic, there have been many glimmers of light that give us hope. Each of us has a role to play in building back better, regardless of the technical field, industry, or discipline we are from. For you, as future leaders, economists, and heads of states, my final message is this. May the experiences from the ongoing pandemic generate key lessons that will empower you to be better prepared for your future roles. 21st century challenges can never be addressed by one country, one industry, or one discipline alone. We have to find ways and means to put people at the center of policies and actions and work collectively to address inequalities. We all depend on and need each other. As our Director General has said, none of us is safe until all of us are safe. Thank you.
What a thought-provoking take on the state of the pandemic and how to recover from this deep trough. It was also a crucial reminder of the mission of the World Health Organization and why we ought to work with it rather than around it. Thank you very much to Dr. Zsuzsanna Jakab.